State licensing requirements for treatment centers hide a hard truth. There is no single national license. Every state decides who licenses substance use treatment, mental health treatment, residential care, detox, and opioid treatment services, and which services trigger licensure at all. Your required path depends on what you are opening and where you are opening it. In this guide, what changes from state to state, the 3 planning questions that matter most, and how strong operators track it all. Serious operators start with state rules, not generic startup checklists. States decide which agencies license each service line for behavioral health programs. SAMHSA's treatment locator and national facility data help you understand the landscape, but your application, inspections, and ongoing compliance obligations come from the relevant state agency. 2 programs offering similar services in different states can face very different pre-opening timelines. And licensing is only one gate. Many operators also need accreditation, Medicaid enrollment, commercial payer contracting, or municipal approvals before they can open safely and get paid reliably. This is where Behave Health comes in. Behave Health's compliance consulting team is designed to help you map compliance to your actual operating model. They can scope the work for the exact program you are opening and coordinate with your healthcare attorney, not replace them. So what actually varies? Which agency issues the license, and which services trigger licensure in the first place? Whether mental health and substance use programs are licensed separately. What inspections are required? Whether ASAM level of care designation is part of licensure. And whether accreditation affects the pathway. The differences are easy to see on current state licensing pages. California's DHCS requires licensure when specified addiction treatment services are offered and ties it to level of care designation or ASAM certification for applicable adult facilities. Florida's DCF runs a formal online licensing system for substance use disorder and receiving facility providers. North Dakota requires stage documentation and review before a SUD treatment license is issued. And Minnesota routes operators to the governing chapter and application process for treatment programs. Stop asking for a quote on the treatment center license. Ask the 3 planning questions that matter most. Which services, facility type, and state rules apply to this exact program? Question 1. What level of care are you opening? Detox, residential, PHP, IOP, OTP, and outpatient programs often sit under different rules or supporting requirements. Start with the service model, not the brand story. Question 2. Will you provide medical services? Incidental medical services, medication services, or OTP operations usually increase licensing and staffing complexity immediately. Question 3. Are you also chasing accreditation or payer enrollment? Plan accreditation, Medicaid enrollment, payer contracting, and municipal approvals alongside licensure, not after it. Strong operators don't just file an application. They build a tracking system. Required licenses and renewals, plus required inspections. Governing policies and procedures, and staffing and credential prerequisites. Facility readiness items, plus payer and accreditation dependencies. And the evidence needed for survey or relicensure. That is exactly the work many teams push into a shared folder, and then lose track of. Stop chasing a single treatment center license that doesn't exist. Get compliance mapped to your actual operating model. Book a demo at behavehealth.com. If you're opening multiple service lines or locations, see how Behave Health supports a durable operating process. Book a demo at behavehealth.com.